Hi, my name is Nicole. Welcome to my channel, Travel to Money. In this video, I am going to talk a bit about health insurance and what to expect concerning healthcare while you travel. I'll share about my hospital experiences in Portugal, going to see an eye doctor in France, and why the US doesn't even compare. At the end, I'm going to share something about laser hair removal that you will not believe. If you are new here, I have created this channel to help you learn about how to travel, adventure, and have fun on the road to financial independence. I have traveled the world, paid off a house in Spain, and I've made big moves toward financial independence. I believe that the road to financial freedom can and should be fun. I hope that you'll subscribe and join me on this journey, no matter where you are starting from. Healthcare is a complicated topic and one that I would first like to acknowledge that I am not an expert in. What I'm sharing today are my experiences and personal opinions. Choosing healthcare options is important and personal, so I'm not making any specific recommendations and would encourage you to do your own research before making choices that impact your health. In my life, I have been fortunate enough to have been generally healthy. I haven't had any major illnesses or diseases. I've never broken a bone, and for all of this, I am very thankful. Knock on wood. Although I am not a fan of the healthcare system in the USA, which will become more obvious in this video, I also understand the privilege that I have in receiving healthcare and that it is not something that everyone in the world has access to. So as I complain about the American healthcare system, please know that I also understand that I am privileged to have access to healthcare at all. I won't drag it out any longer than necessary, but my overarching opinion about healthcare in the US is that it's not healthcare at all. It's health management. Basically, it's a system of greed that benefits from its people needing long-term care. It's sort of like a subscription versus a one-time purchase. Companies like Netflix know that they can make more money and forecast their profits much more easily by charging you every month rather than charging you once or charging you for each movie that you watch. It's the same thing with healthcare. Rather than curing your illness or disease for a one-time fee, encouraging a healthy diet and exercise, they would rather make sure that you need some expensive pharmaceutical prescription that you'll have to take every day for the rest of your life. Did you know that the US and New Zealand are the only countries in the world where it is illegal for pharma companies to advertise prescription meds? The reason it's illegal in other countries is because it isn't ethical. But in the US, our politicians care much more about padding their pockets than they do about ethics. I won't go down that trail any further, but hopefully you get the idea. Let me give you a quick example about the lack of ethics in the American medical system. About 20 years ago, my brother had some sort of sprain to his ankle. I don't remember the circumstances exactly, but he ended up going to the hospital to have it looked at. The waiting room was so full that he had to sit outside on the curb waiting for his turn. They ended up taking an x-ray and told him that he had a sprain, sending him out the door with an ace bandage. I believe the bill for this ended up being around $2,000, but more specifically, there was a waiting room fee of $500 on his bill. A waiting room fee of $500. Now imagine that ER is seeing 50 patients a day. That means they are profiting $25,000 per day by ripping people off, and they're probably seeing more people than that. That is what you call price gouging, and it should be illegal. Unfortunately, that kind of practice in the US is common. Comparatively, my friend from Portugal recently had to go to the hospital. After her visit, she returned home and then was in so much pain that she had to be taken back to the hospital that same day by ambulance. For both of her visits, do you know what the total bill was? It was $0. Her tax bracket in Portugal has her paying 26.5%, which is only slightly higher than my tax bracket here. but her medical care is 100% covered when using the public system. That is quite good. So, with the complications of health insurance in the US, a few years ago, my employer began to offer a health sharing plan instead of traditional insurance. I'm not going to get into the details of health sharing, but you can Google it if you aren't familiar. Prior to taking off for world travel, I did contact them and confirm that they would cover me during international travel, which was really awesome. They said I would just need to submit receipts with translation into English and showing the cost in US dollars. Not every health sharing company covers you during world travel, so make sure you clarify this with the company you use or with your insurance company. From what I've heard, there are also travel insurance options that cover medical emergencies as long as the person is not in the USA for more than a small portion of the year. I would assume that is due to the ridiculously high healthcare costs in the US. Okay, so now for the good news. If you are traveling to Europe, depending on which countries you visit, healthcare can be both excellent and affordable, if not entirely free. When I went to the ophthalmologist in France, my appointment and the 3 medications I needed came to a total of less than €35, and I wasn't using any sort of insurance. Prior to seeing the doctor there, I was also able to visit the pharmacy and receive basic prescription level medications by simply talking to a pharmacist in the store. No doctor appointment needed. I have also had a couple of experiences where I needed to go to the hospital in Portugal. Fortunately, my best friend is Portuguese and knew exactly what I needed to do. In Portugal, they have public and private hospitals. The public hospitals are free, but are still very nice and have a high level of care. The private hospitals in Portugal are a bit of a step up from the public hospitals, and you generally won't have to wait as long. But even the private hospitals are very inexpensive. My friend got me an appointment because I needed an emergency root canal. The service was top notch and I paid less than €200 for everything. That same service would have taken 2 visits and at least $1,000 in the US. Although I've spent a considerable amount of time in Spain, I've never actually had to visit a doctor or a hospital there other than receiving a COVID test in 2021 before heading back to the US. From what I understand, all basic medical services are free when using the public system. There is also an opportunity to pay for private insurance and care, similar to what I mentioned in Portugal. Now for a bit of extra information. I know laser hair removal is a very expensive procedure, and I'm not sure that I have correctly labeled it under healthcare, but I just want to give you an idea of the difference that someone in the US will pay versus what is available elsewhere. Now, we should also keep in mind that as laser hair removal has become more widely available, the prices have gone down a bit. But in the US, to have 6 sessions of full body laser hair removal, you are still going to pay thousands of dollars. Do you know how little it can cost you in a place like Portugal? Around $40 per session. So if you had 6 sessions, that would come to a total of $240. That is less than 10% of what you would end up paying on average in the US. It sounds like it might be less expensive to book yourself 6 quick trips to Portugal. One last point when it comes to health and travel. I feel like one of the difficult things in the US can be having access to healthy food that is reasonably priced, and we focus here on speed and convenience, often falling into eating fast food on a regular basis. But what we put into our bodies really matters. One of my favorite things about spending time in Europe and in Indonesia was the availability of really delicious and healthy food at very reasonable prices, and also that the culture in these regions still places an emphasis on time around the dinner table. The fresh fruit and veg that I get in Spain from the local outdoor markets each weekend was just the best I've ever had and was at a fraction of the cost that I would spend in the US. I think I need to head back overseas very soon. If you've had specific experiences with healthcare while traveling, I'd love to hear about it in the comments. If you've enjoyed this video, please give it a thumbs up and subscribe to join me every Sunday where travel and adventure build financial freedom. I can't wait to see where your dreams will take you.